Hey, everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Tonight we're talking about senior living. This is a topic that I feel like so many people can relate to, whether you are thinking about your retirement, yourself, and the type of care that you might need toward the latter end of your life, or in many cases, you are the child of someone who needs to find a place for your loved one to go to, whether your mom and dad has Alzheimer's and is in need of a location that has memory care services, or if they're simply needing to move into a community that has a little bit more assistance than simply living at home alone. So I would invite you right now, if you are joining us live, welcome to the conversation. Welcome to those who are watching us via the Oregonian, Oregon Live. And I invite you to post your comments and your questions for our guest tonight. We're monitoring that feed throughout this episode, and we would love to answer your questions. Our guest tonight is a healthcare professional with more than 30 years of experience. She has previously served on the boards of entities like Elders in Action. She's been on the Advisory Council for Senior Services for the Volunteers of America. And she's currently the co-chair of what is called the Longest Day Committee for the Alzheimer's Association. She is a senior referral agency employee with Senior One Source, and she's a fantastic resource for the questions that we'll be asking tonight. Grace Ishida, thank you for joining That Expert Show.
Oh, thank you. Thank you, Anna.
Grace, I am so glad that you reached out to offer your information and insight on this topic. I think there's a lot of folks that have chimed in already prior to the episode who have questions about this area. I want to start with where people should start as they begin to look for the right place for their loved one or for themselves. This is so hard because often when they are looking, there is something that has happened medically that is prompting the search. So it can be a really high stress situation.
Yes, yes. Oftentimes it's an emergency, or maybe they are caring for someone, and little by little they realize, gosh, this can't go on forever. Or a lot of times the caregiver, like if it's a husband, wife, or even an adult child, the caregiver gets ill or something happens. And all of a sudden, now what happens? What do we do? Who's going to take care of dad? Mom has to go to the hospital. Or mom fell and broke her hip. What do we do about dad? So, and a lot of times the family has been talking to mom and dad and saying, gosh, maybe let's look at this or let's look at that, different levels of care, different help. And there's such a resistance. And then sometimes there are family dynamics where one sister is siding with mom and dad. Oh no, they're fine. They're doing fine at home. And then the other sister that's in town and doing everything to support them sees that really it's just kind of a train wreck waiting to happen. And maybe train wreck's a little bit strong to use the words, but it's kind of on the edge. And so I always advise folks, really the best thing to do is to start looking earlier than later, because it's so much better to have already an idea about the different levels of care, and also, how much things are going to cost, and what could be done, even if it were just temporary or what we call a respite stay. What could we do? And to be able to decide that before an emergency happens, it's so much easier.
And the reality, though, is that sometimes, like, if you want to, for example, bring mom and dad along to go check out these places, a lot of parents, and understandably, are opposed to the idea altogether. Like, they don't want to think about themselves going into what's called, an old folks' home. They don't want to think about that. It's not a stage of their life that is really pleasant to talk about.
Right. And a lot of times it's because their access or any experience they've had has been negative. Maybe it was 30 years ago, and the way things were in terms of care 30 years ago, it was pretty limited. It was pretty limited to nursing home. And then Oregon really started the forefront with adult care homes and assisted living. And people, when they actually do tour or they move in, or they visit a friend. They see, oh wait, this is a lot better. Oh, I can have my own apartment. I can have my refrigerator with my my drinks in it and my pudding and the things I like, So when they see that they can still maintain autonomy and independence, and it's not going to be an institutional type setting, then a lot of times then they will relent, and then they actually blossom. They actually really thrive. Not every time, and not always right away, but many times after I've helped people move, I hear from them or I contact them and they say, oh my gosh, I didn't think my mom would do these group things. She's not that type of person. She's bingo. My mom won't go to bingo. And then I get the call and they're like, okay, mom's been to bingo 3 times and it's only been 6 days. And she's bragging about how much she's winning. And, and it's like, oh my gosh, she's going down to the meals and she's enjoying it. And she went on they took a car drive to Mount Hood and, or Multnomah Falls. So, and the families then are so relieved. They're like, okay, she's not just sitting in her apartment, but she's actually thriving. She's actually getting her medications on time. She's actually getting a shower. She's actually eating really good meals. And more than anything, she's making friends.
Yeah, because that's the irony is because there's a lot of seniors who are living alone, and while that independence might be great, that autonomy might be great, they might be, fairly isolated because I have dear loved ones that are in their 80s and 90s, and what they're telling me is they're getting lonely because a lot of their friends are dying off, frankly. And so they're outliving their friends, and their social network gets smaller and smaller. So I guess in that way, being somewhere like that where you have a sense of community can be really enriching.
Right. And especially after COVID, married couples, what's really been interesting is it really gives them an opportunity to have some time apart. Like this one couple I was talking about, the wife enjoyed bingo. Dad didn't want to go, but he loved being in the apartment and he could watch his TV shows, and she didn't have to listen to him and he didn't have to listen to her because they had been together a lot during COVID. So it really, So there's just a lot. There's just so much health and just quality of life that can be improved if they're at the right level of care. But that's the key, is knowing the right level of care. And that's not something people automatically know. That's why it's so important. And I will say, like what I do, I'm a referral agent. And here in the state of Oregon, there's actually a clear oversight that's done for that. And, I'm registered with the state of Oregon, so there's a background check and quite a bit that's done to make sure that I'm following rules that we meaning other agents like myself, asked the state of Oregon to do. We actually asked for the oversight because it sets us apart from some of the other more national, a little more hands-off kind of services where we're local people and we know very well the informal information about a community. We know, the quality of the care and the services that are provided, whether it's an independent senior living or memory care or whatever. I mean, because you can walk through and you can tour a place that's beautiful, but if the care is not there, then
it's just kind of a facade. So let's drill down on that if we can. How do you know what type of care your loved one really needs?
Right. And well, that's why calling someone like myself is really important, because there are so many different levels of care here in Oregon. So, and some people think automatically when someone is starting to have dementia or, some cognitive issues, that they automatically have to go to memory care. And you know what? That's not always true. There are people that are in independent living that have some memory issues to, a small degree, and also in assisted living. And So they don't necessarily, excuse me, have to go to memory care. However, memory care, the way memory cares in Oregon provide care, it's really wonderful in that the staff have to have quite a bit of training as well as ongoing training, and just the actual structure of memory care, the way that care is provided, and the regimen. And when I say regimen, it actually is a good thing to have structure and to have scheduling, because for someone with dementia, that kind of regular structure actually helps them, and it brings their anxiety down.
Mm-hmm.
And so those kind of things are important, as well as just everything that's provided, whether it's the way the meals are provided and the activities are provided. It's all done with people that have memory care issues with their well-being in mind.
So memory care is one tier of care, but could you break down for us the different types of care? Because there's a lot of terms I feel like that are thrown around, and I think they mean very different things. So maybe you could start with, the least level of assistance and work up from there.
Right. Yes, absolutely. So independent living, senior independent living, that's not licensed at all through the state of Oregon. It's not licensed care. And so Medicaid doesn't pay for it. You just pay for it on your own. But it's lovely because there are these communities that provide, and some of them provide a lot of services, and some are a little bit more hands-off. But you can have things like medical transportation, outings, and so much structure and community that's just built within the community. They'll have groups and clubs and oh my gosh, and you can find your people, you know what I mean? And so that's important, as well as meals and housekeeping. And then someone might need a little bit of help, and then you can obtain that through other services. Sometimes some of the communities do provide that, and then, or you can, pay for it privately, and yet you can still remain in independent living. Then the next level is assisted living. And a lot of people, here in Oregon, we hear that quite a bit. And so that's similar to independent living, but it is licensed, and people can get things like maybe medication management. Maybe their medications are given to them. Maybe they need a help with their showers or with grooming, or their laundry needs to be done. Some people might even need help with toileting issues, or getting their clothes on and off at night. And then other people just need that really structured environment to help them. And then it helps the adult children sleep at night, because they know, what, if mom falls, there's help there.
Right.
There's help. They're not alone. And they have that 24-hour care. And then another level of care is RCF, which is residential care facility. And that is similar to assisted living, but they also can do even a higher level of care there. So maybe somebody might even need 2 people to transfer them in and out of bed because because of whatever is going on with them. Maybe they can't walk anymore. Maybe they're bedbound. But then maybe they just need a lot of assistance getting around, and they need the structure as well. And a lot of people that have dementia, they can be in an RCF as well. And then memory care is actually that same license, the RCF license, but then they have what Oregon calls a memory care endorsement. And what that is they have to meet another layer of regulations. And like I said, that continuing training for their staff and things, so that if they meet that criteria, then they're allowed to advertise themselves as memory care.
I see.
And then memory care, and they need to be locked. They need to be secure environment.
Right. Okay.
Yeah. And then,
Oh, is there more beyond that?
There's one more. Well, adult care homes, and those are wonderful also. And there are 5 people or fewer in a home, and it's wonderful personalized care in the homes. And there are just thousands of them in the state of Oregon, and some of them have different, like an emphasis or type of care they provide, and those are wonderful. But that's really difficult. You really do need hand-holding to find the right adult care home as well.
So, how do you evaluate these different
Yeah.
facilities? Let's say that, my mom or dad is kind of getting close to that stage. How do I
Hmm.
evaluate, okay, which one is safe? Which one is actually going to encourage my mom or dad to get up out of bed and not have bed sores and encourage them to work on their balance and mobility? How do you research
Right.
that?
Yeah. Well, and at that time, that's when I would say, having them reach out to someone like myself. We have an Oregon Senior Referral Agency Association, and the members of that, they, all of us, almost all of us, the services are free. I want to say that first off, because people always get scared and they say, oh, how much would it cost to have someone helping me figure all this out and then taking me on tours? That's got to cost a lot of money. Well, you know what doesn't? It's actually a free service, but it's a valuable service, even though you don't have to pay for it. But like with me, I talk to the people that contact me. I talk to them. If I can, I talk to the person themselves. Sometimes I talk to physicians in their offices. Maybe they've just finished home health. I'll talk to some of the home health staff to see what's been going on with that person. There is a balance. We have to also respect someone's their right to refuse things. If they don't want to get out of bed, you can't make them. But it's interesting. Sometimes they say no, no, no to their spouse or their adult children. But then all of a sudden, when they're in care, all of a sudden, oh, she's not fighting getting a shower. How did you get her to do that? She would never let me, give her a shower. I have these daughters tell me that so often. And, because it's not their daughter.
Right.
It's that whole role reversal. I can't let my daughter
Yes.
shower me. I raised her.
Mm-hmm.
That's just, she needs to always be my daughter or my daughter-in-law,
Yep.
you know.
That makes
So
total sense. Makes total
yeah. And
sense.
then you can imagine a husband-wife kind of dynamic too.
Yeah.
So so
Yeah, for sure. Yeah, I can see how that would be challenging and why like a third party, a neutral person might be more
yeah.
effective in a lot of ways.
Right.
We have a lot of questions coming in here, and
Yes,
I would definitely love to get to these. I want you
yes.
folks that are watching to be patient. I'll get to them. Um, Let's talk first, though, about cost, because obviously, when I think about
Oh,
care,
yeah.
and I'm constantly having conversations with my mom and dad about, what funds do they have set aside. But I think most of us really have no idea what the baseline costs are for these different types of
Right.
care. Can you give us an idea of the ballpark costs for these types of facilities?
Ballpark.
Yeah.
A ballpark. Well, a lot of the places, like for instance, independent living, it can range anywhere from maybe $2,000 a month on up. Well, for a studio, and then that includes meals and housekeeping. Usually it's a little more than that, maybe 2,300, and plus depends. I mean, it's just like when you buy a car.
Mm-hmm.
You can buy a really nice basic version or fancy, fancy, fancy. So, there are just so many different there's so many different factors. But like memory care, that could in fact be maybe about 5,000 basic, 4,000 to 5,000 basic. But then they add to that depending on the type of care someone needs. So when someone moves into a licensed community, they're assessed by the community, their health team, and then a care plan is put together. And that's where you as family really need to get involved to help, to have input on the care plan and also make sure that it's being done. But so, for instance, somebody that maybe doesn't need a lot of care, maybe they're not on any medications, they can take their showers fine on their own. Their cost is going to be lower, maybe $5,000, $6,000. If somebody is needing, they need to be, they need help with their incontinence, taking care of toileting
Mm-hmm.
and showering and bathing and, escorting back and forth, and their care plan is very intense, then it could even be 9,000 plus, depending.
Wow.
Um, so it just really, so much of it depends on their service plan and the place that they choose and the place they choose. Yeah,
What
but
about
there
the
are a lot of
homes?
different ways to pay.
What about
Mhm.
the homes where you mentioned there's like four, five, or six
Yes,
adults living in the home that are
right.
being cared for? I remember doing stories about this probably a decade ago, but I'm sure that the cost for those have gone up. What have you seen is the normal cost for those? And by the way, is there any help to pay for these kind of things?
Yes, yes. Well, I'll tell you real quick the range. So, an adult care home, gosh, it really depends. I know you hate to hear that, but it can be anywhere from a base rate of maybe 4,000. And if somebody needs lots, and then it moves on up, if they need lots of care, maybe they need awake care all night long. Because most of these places, although there is staff that are there for safety and everything, but they're asleep.
Mm-hmm.
So that's how they keep the costs down. But if you need awake staff and you need a lot of hands-on help, maybe even two people to help you get in and out of bed and to shower and all that kind of, it can be up to $10,000+ a month, even in an adult care home.
Mm-hmm.
Again, there's so many factors. And
Sure.
then as far as paying for it, yes, there's private pay, which is, I know everybody takes a big gulp
Mm-hmm.
because that's tough. But um, if people have long-term care insurance, that's very helpful, obviously. Um, and then a lot of people don't know about VA aid and attendance benefit. That's for veterans that have served during the war. We don't have time right now for me to go through all of the criteria for that, but it's a wonderful benefit that a lot of people don't know about.
Mm.
And it can be anywhere from about $1,800 to $2,000 plus if both of the if it's a husband wife and they actually are even both veterans, it could be closer to 3,500.
Okay.
I had a little cheat sheet with everything written down, and of course it's over there, so I
It's
can't give
okay.
you but there's a lot of people that can help with that, and that would help quite a bit. And then of course people can also spend down, and then Medicaid, which is the state of Oregon, can also provide payment for all those levels of care, not independent living, but for the licensed care.
But if you're using Medicaid, though, are there only particular facilities that you can apply that at, or
Yes, yeah.
okay?
Thank you for asking that. So, yes, so there are some communities that don't have a Medicaid contract, so they take private pay only. There are other places that have a Medicaid contract, but they request that people pay privately for a period of time. They really can't say X amount of months, but the average is about 2 to 3 years. They ask that you pay privately, and then you can seamlessly, you can stay, you stay at that community, and Medicaid then picks up your costs.
I see.
Yeah, it is a process, and we probably don't have time to go through that either. But there's a lot of help
Mm-hmm.
for people going through that process for figuring out Medicaid. But it's better to not wait until you've spent down to that Medicaid level. I always tell people it's you have a wider array of choices if you are choosing a place that will accept Medicaid after a certain period of time. And there are just fewer places that will take people that are already on Medicaid. I mean, there are places that will, but they're fewer and far between. But they are not at all less than in terms of quality. I want to make sure and emphasize that. I don't want people to feel like, oh, that place takes Medicaid, so it's a lower
Mm-hmm.
quality of care. Not at all. There are wonderful, wonderful places and communities that also have a Medicaid contract, which is because they know, gosh, if somebody's in this type of care for several years, it doesn't matter that they sold a home and they can spend it down, and
Mm-hmm.
you really can end up spending your savings.
Let's talk a little bit about the dynamic of, working with your loved one. Eric, for example, who's watching live now on Facebook. Eric, thanks. Would like to know about the idea of independence versus when your loved one just can't take care of themselves, when your loved one is too proud to ask for help. What do you do if your mom or your dad
Hmm.
or whoever it is that you're trying to help simply doesn't want to move, doesn't want to make the
Right,
change?
right, right. Well, a lot of times I sit down with families and I ask, okay, is there a favorite person in the family? It doesn't necessarily have to be the daughter. I mean, I'm working with a family, and the nephew, he can do no wrong. This daughter, no matter what she and her sisters say to mom, it doesn't matter what their cousin says. He can convince her to do anything. He walks on water. So we're going to have him tour with me and mom, right?
Hmm.
And actually, I already toured with the sisters without mom, so that they could help, so we could narrow down the choices. And then when we take the nephew and mom, because she's moving from independent to assisted, and so and I know it changes. Sometimes it's a daughter-in-law, sometimes it's a son-in-law. They'll listen to them, or sometimes it's a doctor, or maybe the pastor. If the pastor says,
Hmm.
everybody is worried about you, I don't, it's hard. And sometimes I tell families, you know, unfortunately, sometimes we do have to wait till a crisis happens. But what we hope for is that the crisis is small and not catastrophic or really, severe.
Right.
Uh, and we can also, sometimes you can say, you know what? Will you do this for me? Will you try it for a month?
Yeah.
Because they have respite stay available at places,
Mm.
and it's exactly for that purpose. You can try it for a month, and then you tell me, and then
Oh,
we'll talk about it after 2 weeks. Let's
right.
see how you do.
That
And
is
so
interesting.
sometimes that's the way to do it.
Hmm.
Um,
I did not
yeah,
know that respite stay it was even a thing. That's really
yeah,
interesting.
yeah,
Judy wrote in and says that she needs information about moving to a retirement home in the near future. She says she's
yeah,
79, husband's 83, they're in fairly good health. They need advice on which scenarios would work for us. So, what happens when you have partners, spouses that want to
yeah,
move in together somewhere? Is that more
yeah.
common now?
It's actually very common. I help a lot of couples. I help a lot of couples. Sometimes maybe there are some care needs. They'll both move into assisted living, but maybe the wife doesn't need as much care as the husband, and that's okay. Her care plan is zero, right?
Hmm.
But at least she's not bearing the burden of all of it. I remember last year I helped a family. The husband was on hospice, and then the wife had a heart condition that some, that it exacerbated it, it aggravated it. And so they finally decided, oh gosh, we need to do this. And they moved into assisted living. And the wife had said, well, I'm going to move back home after her husband dies. But
Right.
once they got there, the husband said, oh my gosh, we should have done this so much earlier. Oh my gosh. And then, but it was wonderful in that, yes, he did pass away, but she actually said, why would I move? Why would I go back home and be in that big house by myself? She'd already planted roots there and had all of that community and support.
Mm.
And so it actually was a wonderful transition for her as well. Um, but, a lot of times people can move into independent living. I know sometimes if the independent living community has different levels of care, I know that I just ran into a friend of mine when I was touring another couple, and she actually has been living at this community for quite a while. Her husband is in the memory care, and she's in independent living. And so she can go and visit her husband anytime, and yet she doesn't have to worry, and she's not awake 24 hours, all
Right.
night caring for her husband. She
Right.
knows that he's in wonderful hands, and she can go visit him anytime. She can just walk across, walk down the hall.
Yeah.
And so There are a lot of scenarios. There's just every one that you could think of. And that's why it's important to sit down with somebody like myself that can kind of help you figure out what type of care does everyone need, husband and or wife. And I'm working right now with a father and a son. The son is disabled. The dad and mom have cared for them. He's 64. He's cared for him all his life.
Wow.
Dad is 90. Dad is 95. And they moved together into assisted living, dad and son. And, because it was getting a little bit hard for dad in the home. So there are a lot of scenarios, and that's what we love doing. The people that, like myself, that do what I do, we love to help families just breathe and relax and say, "Oh wow, I don't have to go this alone. This journey, I didn't even know where to start. There's no roadmap. What's the deal?" And we provide that.
Yeah. Well, I've been there.
Right?
I've had loved ones, not my direct, mom and dad, but I've had loved ones who I've helped put into this process, and it can feel very lonely and very overwhelming. And, and I'm somebody that has a college degree and understands the system better than most as a journalist.
Yeah,
and
exactly.
It was so hard to navigate, to figure out what funds my loved one had, where he should go, how to arrange all of that, how to evaluate places. I mean, it's such a blessing, the service that you offer. And I hope if there's anything that people take from this interview, it's that they don't have to try to navigate this process alone and without insight from an expert like you who actually knows what they're doing. There's a lot more questions that I am going to ask you to answer on social media or via email after this interview.
Be happy to.
Because I think there's a lot more valuable information to share. We'll also put your information that you've shared during this live interview into a tip sheet that people can reference as well. So Grace, thank you so much for being on That Expert Show and sharing this valuable information.
Thank you. Thank you so much, Anna.
Wow, what a wealth of info. Thanks for being here for this episode. We'll put that tip sheet on thatexpertshow.com, and it'll be up here in the next 24 hours or so. You can also go back and check out this episode on YouTube. We also put our content out as a podcast. So wherever it is that you listen to podcasts, whether that's iTunes or Google Play or Spotify or somewhere else, look for That Expert Show. I love hearing from you. This is how Grace got a hold of me. She reached out to me on Facebook, I think it was, and said, "Hey, here's what I do. I would love to share the information, that I've gleaned from 30 plus years of doing this." So reach out to me on Facebook, Twitter, or Instagram if you've got a show topic or idea for who you think I should interview. I love that this show is truly a dialogue, that you get to tell me what you're thinking about and your questions, and we can try to get answers for you. That Expert Show is on Monday evenings at 7 o'clock live. Thanks for those who joined us via the Oregonian as well. And it is That Expert Show, where you help run the show.